How much does Medicare cost? This is a great question to ask, and in this video, I'm going to show you how much Medicare costs so that you can know what to expect when you go on Medicare. If you haven't already subscribed to the channel, I encourage you to do that now. This channel is dedicated to providing you the information you need to understand to make the most out of Medicare. Don't forget to click the bell icon when you subscribe so that you'll be notified whenever I release a new video. For most people, going on Medicare is a great thing. This is especially true if you've been paying some or all of your insurance premiums, or if you've had to pay a very high deductible before your insurance starts to pay anything. Medicare isn't free, but many people are surprised with how low the premiums actually are. The reason these premiums may seem low to you is that you have actually been paying for Medicare the entire time that you've been working and paying taxes. You see, a portion of your taxes are sent over to the Medicare Trust Fund and are used to pay your medical claims on Medicare. Your cost on any health insurance, including Medicare, can be broken down into two categories. The cost of coverage, which is what you have to pay in monthly premiums to have the insurance, and the cost of care, and that's what you pay when you actually seek treatment. I go more in depth on this subject in the video, The Hidden Cost of Medicare. But just like the old saying goes, you can't get something for nothing. If someone is offering you coverage at a lower cost, they are making up the difference somewhere else. I'm not saying that this is bad, you just need to know the details of all of your options before you make your decisions. In this video, we're going to take a deep look at the cost of coverage and then take a look at how these choices will affect your cost of care. For most people, when you turn 65, you'll need to apply for both Medicare Parts A and B. We call this Original Medicare. These are the parts of Medicare that you have to get from the government. You'll go through a private insurance company to get the other parts or supplemental plans associated with Medicare. If you've worked and paid taxes for more than 10 years, you don't have to pay for Medicare Part A. For anyone who is joining Medicare in 2020, the standard cost for Medicare Part B is $144.60 per month. High income earners pay more for Parts B and D. Now, if you file your taxes as a single and make more than $87,000 per year, or file jointly and make more than $174,000 per year modified adjusted gross income, you will pay more for your Part B and your Part D. Now check the comments below to download a PDF with all these numbers. Most people get Medicare Part A for free, and their Medicare Part B will cost them $144.60. But you still need to get prescription drug coverage and either a supplement or a Medicare Advantage plan. And this is where your choices will start to affect both what your cost of coverage as well as your cost of care will be. Let's take a minute and talk about why you need to get anything in addition to your Original Medicare. For one, Medicare was never intended to cover 100% of your medical expenses. That's okay, and you probably don't expect it to. But what you might not expect is that Original Medicare has no limit or cap on how much you could have to pay out of pocket each year. Under Original Medicare, you are responsible for 20% of all your Part B charges. So the primary reason why you need to purchase either a supplement or join an Advantage plan is to protect yourself from a catastrophic medical event. The other thing you need to get is prescription coverage. The short story is, the government says you have to have it, and they're going to penalize you if you don't. So you're probably wondering, how much is a supplement or Advantage plan going to cost you? The monthly premium for a supplement has several variables. Those include which plan letter you choose, your sex, your age, where you live, and maybe even your health. The most popular Medicare supplement in the past has been Plan F, but it's not available for people turning 65 any longer. So now, Plan G is becoming the more popular plan. It's nearly identical to Plan F with one major difference, and it's the most simple supplement option when it comes to getting care. For a Plan G, where I'm at, here in central Indiana, a non-smoking female age 65 would be around $100 a month. A male would be about $10 more. Rates may be higher or lower depending where you're at in your circumstances. You should connect with a local independent agent who specializes in Medicare. They can give you quotes on the plans in your market. And remember, like all things in life, you should expect modest increases on these plans over time. So you have your Medicare Part B premium, for most people $144.60 per month, and let's say your supplement will be around $120. Now you need to get prescription drug coverage. You could have 20 or more standalone plans in your market. Once again, your independent insurance agent will be able to tell you which plan is right for you. The national average price for a Part D plan is right around $33 a month in 2020. The lowest is around $15. Remember, we're just talking about the premiums here, not how much it actually costs to get your prescription. Okay, let's see where we're at now. If you have $144.60 for your Part B, another $100 to $120 for your supplement, and maybe $20 a month for a Part D, you're looking at right about $265 per month for your monthly premiums. But remember what I said about there being two categories of costs, cost of coverage and cost of care? Well, if you choose the plans that I've suggested in this example, your total cost of care for all Medicare covered services in 2020, not including your prescription drugs, would be $198 or less per year. That's right, your out-of-pocket cost for all Medicare covered treatment for the entire year would be less than $200. Previously, I said you need to get either a supplement or an Advantage plan, so let's look at how much a Medicare Advantage plan might cost. First of all, if you choose a Medicare Advantage plan, you cannot purchase a Medicare supplement that covers your copays and deductibles. Most of the time, your Medicare Advantage plan will include a prescription drug plan. Now, you still have to pay your Part B premium even if you join a Medicare Advantage plan, but Medicare Advantage plan premiums can be as low as $0 per month. On average in 2020, the cost is around $36 per month for an Advantage plan. So adding your Part B and Medicare Advantage plan premiums together, your average monthly cost with an Advantage plan could be around $180. But where it gets tricky is when you look at the cost of care on a Medicare Advantage plan. On Medicare Advantage plans, generally, you'll have to pay a copay or coinsurance whenever you seek treatment. So it's really hard to estimate what your cost of care for an entire year might be. If you're really healthy, you might pay very little for your care. But if you have multiple specialists or a major hospitalization, your costs can really start to add up. What we can say is that you will have a max out of pocket. On an HMO plan, that might be as low as $3,400 per year or lower, not including your premiums or prescriptions, but it could be as high as $10,000 per year on a PPO plan if you go out of network. So let's recap. If you pay the standard Part B premium amount and choose a supplement plan G and a prescription drug plan, your monthly costs could be around $265 per month, and you could feel confident knowing that your out-of-pocket medical expenses would not be more than $198 for the entire year. Or you could choose a Medicare Advantage plan with a low or no monthly premium, which also includes prescription drug coverage. And your monthly premiums could be in the $145 to $180 range, depending on what plans are available in your area. And on a Medicare Advantage plans, your annual costs are capped with a max out of pocket, but once again, that cap can be different on each plan offered in each service area. I hope this has helped you get an idea of what the costs associated with Medicare are. I highly recommend if you are approaching age 65 or are already on Medicare, you give your local independent Medicare agent a call. I'm sure they'd be happy to review your situation and give you their recommendations. If you haven't already subscribed, click the button below. If you have, leave a comment with your questions.